Amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease, is a deteriorating disease characterized by a progressive degeneration and loss of motor neurons in the spinal cord, brainstem, and cerebral motor cortex. It is an incurable disease. Upper motor neurons in the cortex are affected, as well as corticospinal tracts and brainstem nuclei for certain cranial nerves. Anterior horn cells are also affected. The sensory system and spinocerebellar tracts are usually unaffected. ALS produces a variety of impairments that are related to lower motor neuron, upper motor neuron, and bulbar pathology, as well as respiratory, cognitive, and other rare impairments. The most common initial symptom in ALS is focal weakness beginning in the arm, leg, or bulbar muscles, which typically begins distally. Muscle weakness progresses over time, but the rate of progression varies in individuals. No definitive diagnostic test or biological marker exists for ALS. When ALS is suspected, different tests and studies are completed to support the diagnosis and to exclude other diagnoses. The main precautions you have to keep in mind when working with patients with ALS is causing overexertion and fatigue, which ultimately speeds up the process of the disease. Mr. Smith is a 56-year-old male diagnosed with early-stage ALS affecting his lower motor neurons. He owns a business as an artist painting canvas, and he wants to continue working for as long as possible. He is experiencing mild atrophy of the right hand and weakness of the right wrist flexors and extensors with a manual muscle test grade of 4 out of 5. During his evaluation, Mr. Smith was able to use the upper extremity bike for 5 minutes with a resistance of 4 before reaching a rate of perceived exertion of 11 on a 6 to 20 scale. He was referred to physical therapy for a home exercise program and to occupational therapy for assessment of his hand and digit dexterity. The first short-term goal I have set for Mr. Smith is to increase right wrist extensor strength to a 4+ out of 5 in 2 weeks so he is able to maintain his career as a painter. His second short-term goal is to increase his time on the upper extremity bike with a resistance of 4 to 10 minutes so he is able to improve his cardiovascular endurance, prevent deconditioning, and continue his career as a painter. He should keep his rate of perceived exertion below 11 during this. And to meet these goals, we are going to work on Mr. Smith's endurance and upper extremity strength while avoiding use of the hand since it is atrophied. Hi, Mr. Smith. My name is Shelby, and I'm a student physical therapist assistant from South University. I'll be working with you today. And what name do you prefer to go by?
Charles.
All right, Charles. So I see here that you were recently diagnosed with ALS, and you're having some weakness in your right wrist. So I'm going to take a look at you today. We're going to work on some exercises. Hopefully we can strengthen the wrist, if not just prolong the strength that you have so we can slow the progression of the disease. I'm going to ask you some questions now. So at this point in time, are you experiencing any fatigue, weakness, pain, or muscle spasms or anything?
Just the weakness in my hand.
Okay. And any other complaints at this time?
Mm-mm.
Okay. So then I would like to ask for your permission to proceed with today's treatment.
Of course.
So I'm going to clean the table really quick, and then I'm going to get you up here to take some measurements. And let me just throw this away really quick. All right, Charles, so I'm going to take some measurements. Are you comfortable here?
Yes.
You? The first thing I want you to do is raise your knuckles up towards the ceiling, but keep your fingers relaxed when you do that. Good, so I've established that Charles is a 3 out of 5 manual muscle test. Relax. Now I want you to do the same thing again, but when you get up there, hold it. I'm gonna try and push you. Don't let me push you down, okay? Go ahead. Ready, 3, 2, 1, push. All right, so Charles broke against max resistance, so he would be a 4 out of 5 manual muscle test for right wrist extension. Now I want you to put your hand all the way on the table, good. And the first thing I want you to do is turn your wrist towards your pinky as far as you can do that. Good, and relax. Now just relax, I'm gonna do that motion for you. Good, and that's a firm infeel. Now I am going to find the capitate for the fulcrum, midline of the lower arm for the proximal arm, and the distal arm is going to be in line with the third metacarpal. So I want you to do that same motion for me. Good. And I'm getting 32 degrees of ulnar deviation for the right wrist. Are you comfortable in this position?
Yes.
All right, so I'm going to take your arm out here. I'm going to test your tendon reflexes, okay? So just relax for me. Good. Good. And then just relax right there. Good. And then flip your hand this way and relax again. Good. So I tested her deep tendon reflexes for the biceps, triceps, brachioradialis, and finger flexors. The biceps and triceps were a 2+, which is normal, and the brachioradialis and finger flexors were a 1+, which is slightly decreased. Started today, I want to talk to you about something you really want to focus on moving forward, which is conserving your energy and pacing yourself throughout the day. So if you push yourself to the point of fatigue, this causes your body to react and actually progress the disease faster. You also want to be careful when exercising or even just doing daily activities because, as you have experienced, ALS causes muscle weakness, and when that muscle weakness reaches a certain point, further attempts at strengthening those muscles will also progress the disease faster. So when you start to feel like a muscle is beginning to weaken, I want you to come back and see me or consult your doctor before trying to do any strengthening. And moving forward, I want you to really start paying attention to what activities seem to cause you fatigue and either spread those activities out throughout the day or modify them so you are exerting less energy. So here is a scale that you can reference. It ranges from 6 to 20, 6 being no exertion of energy and 20 being maximum exertion of energy. The highest you should reach on this scale at any point is an 11, which is only light exertion. So does all of this make sense to you? Do you have any questions for me?
Nope, makes sense.
All right, so we can get started.
All right, awesome.
All right, Charles, so do you feel like you're in a good position on here? Okay, so just make sure you keep good posture throughout, and we have your hand wrapped up so that you don't have to use your hand muscles to grip the handle.
Okay.
So go ahead and start pedaling. I'm gonna get you set up at a level 4 on here. Okay, so we're gonna do this 2 sets of 4 minutes. And remember when we talked about the exertion level between 6 and 20? And you wanna stay either at 11 or below that so you don't overexert yourself. So when you're on the bike, just if you feel like you're fatiguing or you're overexerting yourself, then just take the rest, or you can bring the level down to a 3.
Okay.
All right?
Yep.
And how does this feel?
Feels
Now
good.
we're going to do some strengthening exercises for the wrist. Charles is holding a 2-pound weight in his hand, 2-pound dumbbell, but we have it wrapped around his hand because of the weakness, the atrophy that he's experiencing in his hand. So it's just helping him grip the weight without having to use those muscles. So the first thing I want you to do is actually flip over this way, and you're just going to lift your knuckles up towards the ceiling, just like that. Good. And then when you go down, I want you to go nice and slow. All right, so we're going to do 3 sets of 10 of these, but for the sake of the video, we're just going to do a few. Good. So go ahead and then flip over, and we're going to do the same thing, knuckles up towards the ceiling. Okay, so it looks like you have a lot of turn going on there, so go straight up the midline towards the ceiling. Good. Again, we would do 3 sets of 10, but we're just going to do a few here. How does that feel? Good. So now we're going to do some bicep curls. Again, because you have the atrophy in your hand, we've wrapped the weights around your arms so you don't have to grip onto anything. And I want you to just palms facing forward, and you're going to bring your palms up towards your shoulders and then slowly bring them back down. And we would do 3 sets of 10 of these, but for, again, the sake of the video, we're just going to do a few. All right, and make sure you keep your elbows in towards your side, okay? Don't let them come out. Good. Exercise and the wrist curl exercise, you can do both of these at home for your home exercise program. For the wrist curls, do you have dumbbells at home?
I don't. What is something that I could use at home?
Maybe like a soup can,
Okay.
anything that weighs about 1 or 2 pounds. And then if you have like an ace wrap or a towel, you can just wrap it around your hand.
Okay.
And then for this, do you have the little ankle weights at home?
I actually do. Yeah,
And-
but they're only a couple pounds each.
Okay, so then just put both of them on one arm and do one arm at a time.
Okay, so like this.
Yep.
Just one at a time. Okay. Awesome.
Okay. So now we're trying to simulate what it's like when you are painting at home. Okay. So we have a 1-pound weight on your wrist to work on strengthening that arm. Are you okay gripping that pen?
Yes.
Okay. So we're going to do this 3 times for 2 minutes. We'll just do it briefly today. And are you comfortable in this position? And is this what it would feel like when you're painting at home?
Yes.
Okay, so go ahead and start drawing. And how does this feel? Does that feel like you could go for 3 minutes?
Oh yeah. As long as I'm doing some type of art, I'm loving it.
Good. So now we're going to work on a breathing exercise. As you may know with ALS, as the disease progresses, it often leads to pulmonary complications, so you'll have trouble with your breathing. So this is preventative, so we can help you breathe as well as you can for as long as you can, okay? So this specific exercise is called diaphragmatic breathing. I want you to put one hand on your belly right below your rib cage, and you're going to pretend like there's a balloon in your belly, and when you breathe in through your nose, you're going to blow the balloon up, and when you breathe out through your mouth, the balloon's going to deflate. So keep your chest as still as you can. You don't want to breathe in through your chest, through your belly, okay? So go ahead and breathe in slowly through your nose, and then make a small hole with your lips when you breathe out, nice and slow. Good job on the belly. And I'm going to have you do this 3 sets of 2 minutes. And this is one of your home exercises that you're going to be doing at home, okay? Okay, Charles, so we're all done for the day. Here is the piece of paper with your home exercises on it. It explains everything. If you have any questions, feel free to call or come on in and we can help you out.
Perfect. Thank you so much.
You're welcome.
Appreciate it.